are marching along, singing a song, just like they do.
I am Dr. Victor Escueta from Biñan, Laguna, a bit far from here. I am a certified family physician and I completed my pre-med BS Zoology in the University of Santo Tomas and completed medicine proper in University of Perpetual Health in Biñan, Laguna. And I completed my animal bites training in RITM and infectious diseases in RITM, and my occupational health and safety training in the University of the Philippines Institute of Public Health in UPPGH. Do you believe that 90 to 95% of our illness has something to do with the food we eat? Do you believe in it? Yes? Okay, who doesn't? None? That is why if we have high blood pressure and we go to the doctor, have you noticed a lot of foods are prohibited? Fatty, salty, and oily, and much more. If you got an illness in your kidney and liver, the more foods are prohibited. This time, I am going to prove to you that the food we eat has something to do with our health. And I will prove to you, based on my study and research since October, when I learned about MILA. I will prove to you that MILA is so good and has benefits to our health, and to fight the common illnesses that affects the majority of us this time. So who wants to volunteer to be our subject to give a blood sample? The subjects should have not yet taken MILA ever. I need to. And secondly, you should have not yet taken any food for the past 2 hours since lunch. We got here Mr. Gill and Mr. Abel. I will be giving them soft drinks, which they must drink. Are soft drinks good for our bodies? Are they good? No, right? Who says it's good for our body? No one? All of you say that it's not good to our body. But do you like soft drinks? See, we really got a problem. You say it's not good, but why are you drinking it? To quench thirst. But the majority says because it tastes good, right? It tastes good. To the majority, we prefer taste than what harm it could bring us. We don't care if we get ill. Anyway, it tastes good. We only stop the moment we get ill, just like cigarettes and liquor. We only stop when we get problems in our lungs. Why did you say soft drinks are not good to our bodies? Due to acidic. What else? It has caffeine, so stimulant, not good, especially to the kids. What else? It has lots of sugar. Do you know how much sugar it has in a 12-ounce size bottle? 12 teaspoons of sugar. And above all, since it is carbonated, it is destroying our kidney. That is why we got a lot of patients this time. At a very young age, they already undergo dialysis. At an early age, their kidneys are damaged. And do you know that this time soft drinks are being used in cleaning toilet bowls? That's true. So soft drinks are not good since it destroys our kidneys. Aside from this, I will also give Mr. Abel and Mr. Gill a hamburger. Most of us go to the fast food and buy burgers. Is it good to our body? Some say no, some say it's good. You're a bit correct. The bread is good to our health, but the patty isn't. Because if you bought this at a fast food chain, it has a lot of preservative and food additives. And a lot of studies prove that preservatives and food additives cause illnesses to our body. So it's not good to those who have illness in the liver, are high in cholesterol, and have kidney problems and high blood pressure due to its salt content. So let us destroy the heart, veins, kidney, and liver of Mr. Abel. But aside from that, there's an addition of French fries. Okay, fries are vegetables, but are they good to our body? Are fries good to our body?
Nakakabuti po ba ang French fries?
What do you think? It can make you feel full, okay?
Lahat nakakabusog. Sige, mamaya ko po
Okay, I will answer this question later. Are French fries good to our bodies?
Mabuti po ba
Okay?
ang French fries sa katawan? Okay?
So, Mr. Abel and Mr. Gill, please eat this food now. You have to consume it all before I am going to start my lecture.
Kailangan ubos niyo muna yung pagkain bago ako magsimula sa aking lecture. Kasi para na-absorb na yun ng katawan.
Blood sample was taken from Mr. Gill. Here we go. Okay, next is Mr. Abel.
Yan. Yun. Okay.
Okay,
unahin ko
let's
po
show
si
Mr. Gill's blood
Kuya
first.
Hill. Pakita natin.
Mr. Gill has a weak immune system. Check it out.
Ay.
Check his red blood
Ang
cells.
kanyang red blood cells. Hindi po maganda.
It's not good. Aside from sticking together, it appears like polka
Kung sa
dots.
dikit-dikit, parang polka dots. Ito po ay sign ng
It is a sign of a very, very poor immune system.
white blood cell po yan.
These are white blood cells. They move, but they stick
Wala
together.
po kayong makitang normal na
We can't
red
spot a
blood
normal red blood cell.
cell. Oh. Dikit-dikit na. Tapos,
Healthy cells should look like this.
ganyan. Ay,
Great, there's still one. Oops, make it two.
may natirang
This is how normal cells look like, but the rest are not
po
good.
ganyan. Kaya nakita nyo yung the rest. Hindi.
You really got a problem with your immune system, and you got some illness, I assure you that.
May sakit po kayo. Sinisigurado ko may sakit. Dahil po sa inyong ito, tingnan, ito po ay white blood cell. White blood cell.
You've got an infection. Did you see this? It's a bacteria. Check it out. It's moving.
Isa doon, gumagalaw. May infection kayo. May sakit. Anong sakit nyo kayo?
Are you having some illness? Skin disease? Okay, this is a sign of having an allergy or having a weak immune system.
Mo yan, ganyan. Okay? So,
Okay, let's now check Mr. Abel's blood.
Kuya Abel, tingnan natin.
This is Mr. Abel's.
Ito po yung kay Kuya Abel. Kay Kuya Abel naman. Oh. Ang gulo.
I can't see a normal red blood cell.
Makitang normal na red blood cells.
There, it should look like this. We also got two normal here.
Dalawa din. Normal.
Why is it like this? Do you have an illness?
May sakit kayo? Wala naman. Hindi nyo alam. Wala kasi
Are you alcoholic? Sometimes? How often?
Gano'ng kadalas ang minsan? Ha?
You have a high sugar level?
Sige. So, hindi po
His red blood cells are not looking good.
kanilang red blood cells, so gulo-gulo.
This one is a bubble.
Kita nyo,
I can't see good cells.
maganda. Ito, may mga, ano din parang polka dots po yung ano nyo, yan.
Okay, this is what happens when you have acidic blood.
Kapag po acidic masyado yung inyong dugo, hindi po maganda yung inyong blood.
Let us now give Mr. Abel a cup of Mila. Let us take a sample first from Mr. Gill.
Kuya Hill. Okay.
We didn't give Mila to Mr. Gill.
Yan.
Okay, I will show Mr. Gill's blood cells first.
Kuya Hill, yan. Tingnan nyo,
Check it. It's running, but still they stick together.
bilis.
This is his blood.
Yan.
See, they stick
Ayun,
together
kapit
like
siya,
coins.
Parang barya na pinagdikit-dikit.
Nothing is changed. His blood is so dreadful to look at.
Kita nyo? Yan po yun, oh. Andun pa rin yung mga immune cells niya.
There's really nothing's changed. They still stick together like
Kaya
coins.
parang pinagpatong-patong na barya yung kanyang red blood cells. Dikit-dikit pa rin. No? So,
After
ang
30
change,
minutes, his blood
30
looked the
minutes, Hindi
same.
pa rin nagbago yung kanyang dugo. Yan. So, ito po
This
yung
is what happened to Mr. Abel, who has
sa
taken
Escueta
Mila.
po na nag-take ng Mila.
After 30 minutes, this is what
ito po
happened.
ang nangyari.
Did you see it? Now the red blood cells move freely.
Red blood cells. Parang nakita nyo
Same with the picture you saw earlier in my lecture, right? There you go. The red blood cells look so happy and so alive. So let's give Mila an applause. Did you see it? They move freely and not sticking together. The effect is very immediate, right?
So, makakatulong po sa inyong mga sakit.
Very healthy red blood cells. They can now move and roll.
Hindi na sila dikit-dikit. Nakaka-move na sila, nakaka-roll, nakaka-ikot. Okay? Nawawala po yung...
So it's very fast. Earlier, his blood didn't look this way, okay?
Okay po? So, maraming
So thank you
salamat.
very much.
If all our life is but a dream,